Hi everyone. We are just about to get started with the American Kidney Fund's congressional briefing live from Capitol Hill. Just hang with us for a couple of minutes and we'll get started at just about 10 a.m. Eastern. Hi. That's true. We're live.
Are we ready to answer?
Yeah, whenever we want. You got it?
Good morning.
Good morning.
Can everyone hear me? That's a test, whether it's on or not, as long as we can be heard, that works just fine. I want to welcome you to the annual fly-in of our patients who've come to Washington, D.C. to help all of us better understand the impact of kidney disease and what we can do about it. We're very delighted this morning, first off, to have Congresswoman Susan Delbaney. She's representing the 1st District of the state of Washington. She serves on the Ways and Means Committee, where she works tirelessly to increase patient access as well as affordable health care. So we're delighted to have her join us. She also serves on the House Budget Committee. She doesn't know it, but that was my old stomping ground. I worked for the House Budget Committee for a number of years as a staffer, and so I know the task that you have. There, she's focused on achieving a bipartisan long-term budget solution, and we wish you well in that goal. She is the Democratic chair of the House Kidney Caucus, and also a very active member of the Caucus for Women's Issues. We're delighted to have her join us, and I'm going to turn the podium over to her.
Thank you so much. Good morning.
Good morning.
There we go. It's great to be with you this morning, and hope you are all having a great trip out here to Washington, D.C. I am a co-chair of the House Kidney Caucus and very involved in the Congressional Caucus on Women's Issues. This is kind of an important convergence that we're seeing here today, and happy to talk about women and kidney diseases. All of you are coming together. There are also two excellent reasons for all of us to be gathering today. It's World Kidney Day, and it's International Women's Day. So I think that's another reason why things are coming together. And not to mention that March this month is Kidney Month. So what better time is it to have a conversation about women and kidney disease together? Kidney disease, I don't have to tell all of you, is often very silent disease, symptomless, a condition that is the 9th leading cause of death. Presents unique challenges for women in particular. Not only are they more likely to have kidney disease, but they're also more likely to be a kidney donor. And of course, women are more likely to be caregivers to loved ones who are struggling with kidney disease. Kidney disease also presents unique challenges to women who want to have children. And as you'll hear from our first speaker, Dr. Jessica Tangren, being on dialysis no longer means that you can't get pregnant and have a healthy baby. But pregnant women on dialysis have special needs. Once you have a child, who takes care of him and her while you're on dialysis 3 days a week? We also are going to hear from a multi-generational family from Philadelphia dealing with kidney disease and caregiving. Melissa Baker does dialysis at night several times each week, and her mother, Ann Baker, picks her up at 4 o'clock in the morning from the clinic. Melissa is also in the process of adopting her foster son, so the caregiving is across generations. We also have other women here today who will tell us their stories of being pregnant with kidney disease and of giving the gift of life to her husband in the form of a kidney donation. While these stories translate to several key policy takeaways that we all should keep in mind. We need better family leave policies for caregivers. We need to make sure that everyone has affordable and comprehensive health care. We need to make it easier for people to donate organs, and that women's health issues are human health issues. So I want to thank the American Kidney Fund for inviting me here today, for all of the work that you're doing. Today is the annual Advocate Fly-In, as you know. Many of you came across the country to be here, and many people today are here to educate their members of Congress. Go across offices, so we're going to see a lot of blue across the Capitol today, to educate members of Congress about what it's like to have kidney disease and how we can help them and their loved ones lead better and healthier lives. So the theme for Kidney Month is Empower, Fight, and Honor. And that's something we can all get behind, not just now, but all year round. So keep it up. I look forward to working with all of you in the months and the years to come as we continue to push policies forward and increase awareness across the country. So thank you for all the work you're doing, and thank you for allowing me a few minutes to be with you here today.
Thank you so much, Congresswoman. We know what a busy schedule you have, and we really appreciate your dropping by to chat with us for 2 minutes. I was so busy introducing you that I forgot to introduce myself. I'm LaVarn Burton, and I'm President and CEO of the American Kidney Fund. We truly are delighted for all of our advocates who have joined us today, many congressional staffers and others who are here. This is a day, International Kidney Day, where we really want to focus on kidney disease, and particularly this year, the congruence of International Kidney Day with Women's Day. It's just such a tremendous time to talk about this disease and how it affects women, not only as a patient who may have kidney disease, but also as caregivers. And so we look forward to the discussions today. I also want to extend a special welcome to everyone who may be joining us on Facebook stream. This is the second year we've done that, and so we look forward that the messages that we'll hear today not only will go to the ears of those who are in this room, but as well will go to hopefully millions, or if not thousands, of folks who are joining us on Facebook. We have some special guests. We have a couple members of the Board of Trustees for the American Kidney Fund. We have our chair, Bob Tarola, who's sitting right here.
Good morning, and thank you for coming.
And also we have William Schuyler, who's a member of our Board of Trustees.
Good morning,
Thank you.
everyone. Thank you.
I don't think, if I'm looking around the room, I don't want to miss any trustees. They're our boss. Okay, so thank you so much for joining us. We appreciate your being here today and everything that you do in the interest of patients. There are 31 million people in this country who have kidney disease. The vast majority of them do not know it. Our role at the American Kidney Fund is to help people fight this disease. Help them fight it when they have it by providing financial assistance to help them get health care, and also to provide information and education so that their outcomes are as positive as possible. Another very important part of our role is for those 30 million people, many of whom do not even know that they have the disease. We want to increase that awareness for them as well as for others who might be at risk. So we go to work every day fighting to achieve those goals of supporting those who have the disease and trying to increase awareness and education for those who may be at risk for this disease. Unfortunately, this is a very much an uphill kind of battle because this is not a top-of-mind issue. We hear of so many important diseases that people are dealing with. Very often we don't hear or know about kidney disease until we meet somebody who has had the disease or is in the midst of dealing with it. That's one thing that we want to bring to an end. If you look at our vision statement, we envision a world without kidney disease. We do think that is possible. It is a very ambitious goal, but working together, we do believe that one day we will get there. And so in the meantime, we will continue the fight in which we are engaged. We're delighted today and over the next couple of days to have 24 advocates, patients who are dealing with kidney disease, as well as family members who come to Washington to talk with members of Congress and senators about this disease. The 24 people who are with us are representative of the 8,700 people that we have in our advocacy network. And to go even further, they are really being the voices for 700,000 dialysis and transplant patients in this country. As they tell their stories, it goes beyond them. It goes to all 700,000 of those folks who are dealing with this disease and their family members and loved ones. We know that kidney disease is also a very serious disease. and that for many people it can be fatal. We want members of Congress, we want staff members to understand that. Dialysis is a wonderful technology that prolongs lives. The ultimate treatment is a transplant, but there are so few transplants. And so those are the stories that we want to share. Specifically, there are two pieces of legislation that we're going to focus on during this Washington fly-in. The first is H.R. 1270, and we're asking members to take a look at signing on to that bill. It's called the Living Donor Protection Act. And what this bill is designed to do is to support someone who wants to donate a kidney. Every day, 13 people across this country die because of kidney failure. Last year, 5,800 people donated kidneys to those who needed them. This legislation is designed to protect donors. It's designed to make sure that insurers are not allowed to deny coverage for life insurance, for disability, for long-term care because someone has donated a kidney, or to charge higher premiums to those people. It is also designed to make living donation covered under the Family Medical Leave Act. If you want to do something good, you ought to be rewarded, not punished for doing that, and that's what this bill is all about. The second bill where we're asking members to consider signing on is H.R. 3976, the Access to Marketplace Insurance Act. This bill is gaining quite a bit of momentum. There are 124 members of the House who signed on to sponsor this bill. And this bill is really designed to protect patients' access to health care, protect access when patients have to turn to a charitable organization like the American Kidney Fund to help them pay their premiums. Believe it or not, insurance companies are saying to people that if you get charitable assistance in paying your premium, you can't be covered under our plan. One of the great disadvantages of being in kidney failure is that the vast majority of people are no longer able to work. You're going to hear that later this morning from many of the patients themselves. Consequently, they're not able to pay their insurance premiums because they don't have the resources. People with kidney failure are largely eligible for Medicare, but you have to pay a premium under Medicare. And so they can't access Medicare if they can't pay the premium. That's where the American Kidney Fund comes in. We assist more kidney patients than any other charity in this country. Last year, we paid health insurance premiums for $74,000. We assist people who are on dialysis. We assist people helping them get the transplant, paying for the procedure, and then helping them after that transplant has been completed. We want to be able to continue to do that. We have thousands of people around the country who contribute to the American Kidney Fund to enable our ability to do that. And yet insurance companies stand in the way in many instances, blocking us from being able to help patients. H.R. 3976 would prohibit insurance companies from doing that. We ask that you consider that bill when you go back to your offices. We've got a number of people from the American Kidney Fund and from our Government Relations Department who'll be more than happy, and I'll be more than happy, to talk with congressional staffers who might be in the room about what that bill does. So we look forward to that kind of discussion. I think that we've had the Congressman speak. We have another very illustrious speaker who's joining us today. And I am delighted now to introduce her. She's Dr. Jessica Tangren. Dr. Tangren is a clinical scientist in nephrology, fellow of the American Kidney Fund. She has joined a long list of nephrologists who have received fellowships from the American Kidney Fund in order to begin their research career. We think that it is very important, while we spend a lot of our resources helping people who have the disease, ultimately we do want to find cures and find better treatments. And Dr. Tangren joins a long list of fellows who've been recipients of the American Kidney Fund Clinical Scientist and Nephrology Award to begin her research. Her work is focused largely on women and kidney disease. She's a fellow at Brigham and Women's Hospital, Massachusetts General Joint Nephrology Fellowship Program, where she is studying renal and vascular dysfunction after acute kidney injury, and particularly its impact on women. Her goal is to become a physician scientist in nephrology with a focus on the management of kidney disease in women. And we're just so delighted that she has joined us today. Dr. Tangren.
thank the American Kidney Fund for having me here to talk about reproductive health in end-stage kidney disease with a focus on kidney disease or dialysis during pregnancy. Chronic kidney disease affects upwards of 3% of reproductive age women in the United States. In general, women are having children later in life, and rates of obesity are increasing. And as such, we anticipate that the number of women with a diagnosis of CKD before starting their families will only increase. Unfortunately, chronic kidney disease is associated with some of the highest adverse maternal and neonatal outcomes compared to women with other pre-existing medical conditions. Women with advanced CKD are also at risk for disease progression during pregnancy, oftentimes hastening the need for renal replacement therapy and shortening their life expectancy and potentially restricting their ability to care for their children, who may have complex health needs as well. Pregnancy in women with kidney disease provokes anxiety in nephrologists and obstetricians alike. And because of the high risks associated with pregnancy in women with end-stage renal disease, many women have been strongly advised by their physicians not to conceive or to wait for a kidney transplant before contemplating pregnancy. Qualitative research has revealed that many of these women are traumatized by their clinicians warning them against pregnancy and feel a devastating loss about being denied motherhood. Advancements in the delivery of dialysis and obstetric care have led to vast improvements in the birth rates for women, and live birth rates for women on dialysis. So pregnancy for young women with ESRD is now more feasible and safer. However, these pregnancies do remain high risk for both maternal and fetal complications, necessitating experienced multidisciplinary care. Following the first live birth reported in a woman receiving hemodialysis in 1971, the number of successful pregnancy outcomes for these women have been increasing dramatically. And we've seen substantial improvements in the last 30 years. In the 1980s, the live birth rate for a woman on dialysis was less than 40%. However, looking at modern cohorts collected recently, live birth rates are upwards of 80 to 90%. While some of this reflects improvements in neonatal care, there have been dramatic improvements in the delivery of dialysis to pregnant women that have contributed to improved outcomes for mothers and their babies. Intensification of dialysis has been identified as one of the most important determinants of a successful pregnancy. In a series following pregnant women on dialysis from the US and Canada, longer weekly dialysis times were associated with improvement in live birth rates, fewer preterm deliveries, and improvement in fetal birth weights. As highlighted in the figure on the right, women receiving less than 20 hours of dialysis a week had infants that were born earlier at lower birth rates, and in this group the live birth rate was only 48%. This is compared to a live birth rate of over 85% in women who received more than 37 hours of dialysis per week. As a comparison, in the United States, the typical weekly dialysis schedule for a non-pregnant patient is 12 hours. In addition to improvement in these fetal outcomes, women on intensified hemodialysis required fewer blood transfusions during pregnancy and had much improved blood pressure. Overall, the rates of maternal deaths were extremely low in these populations, and the rates of congenital fetal malformations were no different than in the general population. Research has also highlighted that we need to do better in the United States. In the same study of US and Canadian patients on dialysis, live birth rates were much higher in the Canadian cohort than in the American cohort. In the Canadian cohort, women on average delivered at 36 weeks of gestation compared to only 27 in the United States. While outcomes for children born at 34 weeks or later are excellent, unfortunately, infants born at 27 weeks are at high likelihood to have some long-term disability. We believe the difference in these groups is because the Canadian cohort received substantially longer dialysis times. In this US cohort, which spans 1990 to 2011, the average weekly dialysis time was only 17 hours, compared to over 30 hours in the Canadian cohort. Fortunately, there is now broader appreciation of the importance of intensified hemodialysis during pregnancy, and augmentation of dialysis hours during pregnancy has become standard practice. However, financial incentives for dialysis units in the United States are misaligned with the needs of pregnant women on hemodialysis, whose weekly dialysis times may equal that of 3 standard patients on dialysis. So in conclusion, successful pregnancies are possible for young women who reach ESRD during their reproductive years. While these pregnancies do remain high risk and require multidisciplinary care, improvements in dialysis delivery, including intensification of dialysis, has allowed hundreds of women on dialysis to have successful pregnancies. Despite these improvements, multiple barriers exist to the optimal care for women with ESRD during pregnancy. We must do better in providing access to intensified dialysis for women who are pregnant or who want to become pregnant, including the availability of longer dialysis times in conventional outpatient hemodialysis centers, through expansion of nocturnal hemodialysis programs, as well as providing more access for home therapies such as home hemodialysis. Further, the need for emotional support for these vulnerable young women cannot be understated. The commitment necessary to carry a pregnancy on intensive dialysis, as well as the challenges of raising a child, can prove extremely daunting for a woman with a chronic illness. And transplantation should be the goal for every woman. We also need to improve the long-term survival for women on dialysis and after kidney transplantation. And unfortunately, in a national study from Australia, only 1 in 4 women who had had a pregnancy after a kidney transplant was not alive to see their child graduate from high school. So the focus on women's health needs to be throughout the arc of a woman's life, and not just during intensified interactions with the medical system, such as pregnancy. So many nephrologists who don't work with young women routinely ask me why on earth a woman would want to put herself through the physical and emotional stresses of a pregnancy in the face of chronic kidney disease. However, I'm reminded every day by my patients why this work is so important. As one patient recently said to me, quote, "The doctors think I'm crazy to want to have another child after all of the complications I've had during pregnancy with my daughter. I know my life is going to be shorter because of my kidney disease. I want my daughter to have a sibling to lean on. I don't want her and my husband to be alone when I'm gone." These women understand the sacrifice involved in having a pregnancy while on dialysis and are strongly motivated to have healthy children and to live long, healthy lives themselves. It is for these women and for their families that we must continue to make improvements in kidney disease care for women. If anyone has questions?
Are there questions? Anyone?
This was actually before you spoke, and I'm not sure you might know the answer, but they mentioned that part of what the American Kidney Fund is looking to do. Oh, I'm so sorry. I'm a very loud speaker anyway, but microphone definitely helps. I was going to ask, one of the earlier speakers made it sound like it was kind of a complicated process to administer any kind of like kidney transplants to people. What are some of those difficulties associated with getting a transplant?
I'm going to pass it off to the experts.
I'm sorry, I did not intend to imply that there was difficulty in the process. There's difficulty in getting an organ that's available. There are 100,000 people, over 100,000 people on the transplant list, and the most recent numbers are that only about 17% of those folks were able to get a transplant. And that's largely because of the availability of organs.
Okay.
I'm just curious then, in hearing the disparity between the figures for Canadians and American women, how much progress has been made in providing the intensive dialysis needed to American women?
So Fortunately, there are a few Canadian nephrologists who have really championed this cause, and there is much wider acceptance in the United States that longer dialysis times are necessary to get a woman through pregnancy safely. It's still a challenge in the United States. It's hard for a dialysis unit to accommodate 36 hours a week for one patient. But I do believe that through events like this and through increased awareness, the word is spreading that these are women who, it's for a short period of time, require more resources. And in the long run, it results in improved health for the mother and improved health for the child. And the cost of caring for a preterm child is exponential. So there is increased awareness. We don't have data from the United States since 2011, which is when that study was published. My sense from working with these patients and working with other nephrologists is that outcomes are definitely improving.
But are women receiving that intensive treatment now in this country?
So for I can speak to my own practice, but yes, we routinely will dialyze women for 24 to 36 hours depending on their need during pregnancy.
And who pays for that additional time? Kidney fund?
That's a challenging question. So they're still covered by insurance. We bring many patients into our own hospital, inpatient hemodialysis. I'm not a financial expert, so I'll defer who's paying for that.
Thanks very much, Secretary. The American Kidney Fund pays health insurance premiums for people when they are on dialysis and post-transplant. One of the great advantages of that is that we pay for comprehensive health insurance. So whatever benefits there are under a person's health insurance plan will be available to that person. And so to answer your question, if the patient is someone whom we are assisting, then yes, it would be paid through the health insurance plan that we're funding, where we're funding the premiums.
Any other questions for Jessica?
I'm not sure who could answer this question.
We'll do it together.
Thank you. So is the only obstacle for patients to receive the intensified dialysis the lack of funding or the lack of insurance, or is it the availability in the centers, or what is, I'm confused why there's such a disparity between Canada and the US.
So one of the main differences is in Canada there is much broader use of home therapy. So many hemodialysis patients dialyze at home, and it's easy to increase your schedule to 36 hours. Providing 36 hours in center can be logistically challenging, especially in areas where there isn't an overabundance of dialysis chairs. So really improving access to home therapies in the US would solve a lot of the problem.
And I would add as well that there are, I guess we have to do microphone despite how loud we talk because of the Facebook streaming, so thanks for the reminder. There are centers that focus specifically on women and pregnancy issues and who do provide that kind of intense support. As with all care, it's in many instances it's a matter of the patient making sure that the staff at the center understand what the patient's goals are and that they're working with that.
Any other questions for Jessica? All right, well, we'll call up our next panel.
Before we call up the next panel, I also want to very much thank Dr. Tangren for coming down from Boston and a very busy schedule to be with us this morning. We're delighted to have you.
Good morning, everybody. I'm Holly Bodie, the Vice President of Government Affairs at the American Kidney Fund. So I just want to say thank you again for so great to see so many people in here and people take an interest in this issue. So we're really grateful for so many people coming. And we hope it wasn't just a breakfast burrito. So we have two patient panels today that I'm going to call up the first. So we have, I think as LaVarn mentioned, today is our annual fly-in, and we've got patients from all over the country who come in to talk about what it means to have kidney disease and what the work of AKF does to help them. So we have two of our advocates that are going to join me up here today to talk about pregnancy and childcare as a person with kidney disease. The first person is Angela Lattimore. She is from South Carolina and is a 17-year in-center hemodialysis patient. She lost her kidney function during pregnancy, and her son was premature. Her son, who is here with us today, was premature at 7 months and 5.5 pounds, but now he's a senior in high school and he wants to be a doctor. And Angela wants people to know that ESRD is not a death sentence. Our second patient on this panel is Angeles Herrera. Angeles was born in Nicaragua and has been dealing with kidney issues, her entire life. Although she did have a kidney transplant back in 2007. She only had one working kidney during her pregnancy because of low kidney function, which gave her high blood pressure. So she had to be on bed rest for 2 months. Her baby was born a month premature and it was a high-risk delivery. So I'm going to turn it over to the two ladies who are going to not only talk about pregnancy and kidney disease, but I think what it means to be a parent and a mother while caring for a child and being on dialysis. So,
okay, thank you. Thank you for having me today. My name is Angela, like she said, and I was diagnosed initially during my first trimester. I went in to see the doctor because I was feeling overly tired, more so than I thought I should be at that point in the pregnancy. And they did tests, and they did urine analysis, and it came back with high creatinine levels, which triggered, there's possibly something going on with your kidneys. So we did a larger band, and they said that I was going into kidney failure, and if I wanted to save my kidneys, they suggested that I terminate the pregnancy, which we did not do. I was like, we just have to wait until the baby is here, and then we'll work on the kidney issue. At 5 months, I was put into the hospital. I had to have complete bed rest. They started treating the baby with steroids so he would be ready to come because we knew that he would have to come early. At 7 months, I had gained over 120 pounds in fluid, and the baby was in distress. And so they did an emergency C-section, and he was born at 7 months, 28 weeks, at 4.5 pounds. He was in the NICU for 2 days. He almost beat me home from the hospital. I came home on a Friday 2 months later, and he came home that following Monday. So we're here today. He'll be graduating in June, and he wants to be a pediatric nephrologist.
Good morning, everyone. Thanks for attending our event. Again, I'm Angeles Herrera. Sorry, it's okay. And I can tell you how happy and excited I am to be here today. It's great to be here celebrating the Women International Day, the Kidney Day, but I also have a special celebration. A few days ago, I celebrated my 11th year kidney transplant anniversary. So I'm very excited. It's a very special celebration. I have struggled with kidney problems my entire life. I call it, life is given to me in doses. When I was about 3 years old, I had an acute kidney failure. My parents were told that I was gonna die. Fortunately, I didn't because the toxins in my body did not reach my heart. And for some strange reason, we call it a miracle, one of my kidneys began to work. And I went on with my life thinking, I'm the miracle girl, I'm just gonna be fine. Then when I got pregnant, the kidney problems came back again. I learned that I had lost one of my kidneys and that I had low kidney function because of the stress of the pregnancy. So I was put in bed rest I think it was my 6th month. I was in bed rest for 2 months. My son was born a month early. It was a very, very difficult and complicated high-risk pregnancy. They really had a very hard time monitoring my blood pressure. And even during labor, at times I felt that that my body and my heart could not deal with the intensity of delivering a child. Fortunately, that worked out all right. And once again, I thought kidney problems were gone with the pregnancy, and I went on with my life. As part of my career, I am required to have yearly checkups. So during one of those checkups, they realized my kidney function had drastically decreased, and I was requested that I follow up with a nephrologist. And I did, and the nephrologist decided to do a biopsy. And I remember just like it was yesterday, when the doctor walked in the room, she didn't have to say anything. I just looked at her face and I knew I was in trouble. It turns out that I had developed a Burgess disease, which is a disease that's very common in minorities. And it's a very slow disease. Only 10% of folks that develop this disease actually go through kidney failure. Unfortunately, I was one of them. What the biopsy showed was that my kidney, my only working kidney, had tremendous amount of scar tissue, and that I was going to go through kidney failure. At the time, my son was graduating from high school, and my biggest fear, I was a teen mom, I was his main provider, and my biggest fear was to leave him alone in this world. While I only believe in quality versus quantity, and the thought of living the rest of my life attached to a machine was definitely not how I had planned to live in my 30s, I had no choice. I wanted to be here for him, so I had to do whatever I needed to do. I was very fortunate. I have 12 folks, family members and friends, that tried to donate a kidney, but none of them worked out. So the time came when I had to make a decision. I decided to do in-home dialysis, peritoneal dialysis, because I figure, well, I have to be here, and no one is going to take better care of myself than myself. So I became my own nurse. I slept attached to a machine for 10 hours every day. Did not need to set up an alarm because my dialysis machine extracting the solution out of my body was painful, and I knew it was time to get up. It felt like I lived for my treatments, my job, and my son. I can't tell you how difficult dialysis was for me. It was very emotionally draining and also physically draining. I'm a type A kind of person, and I actually dedicated myself to make sure that I was going to follow every single instruction from the dialysis nurses, the doctors, and I did. But every single time I went to the dialysis center and I got my checkup, the reality was I was getting sicker and sicker. And regardless of what I did, the quality of my life was decreasing more and more. Everything that I love, I'm from Nicaragua. I love my rice and beans and tortillas. I couldn't have that anymore because I had too much phosphorus. I'm a rabbit. I love vegetables. I couldn't have that anymore because that's potassium. And although potassium is really good for you, it's also what is used for a lethal injection. So every day something was taken away from me. But through all that, the absolute most difficult part of dialysis was seeing the fear in my son's face, come up the stairs, see me attached to a dialysis machine. And fearing that I wouldn't be here for him. That definitely by far is the hardest done in life. But with all that, I actually had it easy. I really did. I was very fortunate to be in that very small percentage of folks that are able to still work, still maintain their health insurance, and get the special accommodations that were needed at work to be able to do my treatments and be able to do my work. But I am an exception to the rule. Many of my friends in my dialysis center were not as fortunate as I was. Many of them have lost their jobs, have lost all their organs. It all started with their kidney, but because they have been in dialysis for so long, they have lost other organs. And the only reason they were able to have their treatments, it's because of organizations like AKP, American Kidney Fund. I'm here today sharing my story, not because this isn't about me anymore. I'm healthy. I have a 33-year-old son, and I celebrate life these days. But I do wonder, and I never forget, the pain I felt and the agony I felt during my dialysis years. And if by sharing my story, I can prevent one person from not having to go through that, I will feel that I've done my job in this world. I'm here to request your support for organizations like the American Kidney Fund. And most important, I'm here to beg you to take action, to beg you to put a face in a story, to beg you to do your job. Please support legislations like the two bills that we're talking today. I think everybody deserves to have the treatment that's necessary to be alive. And if we make it easier for living donors to maintain the quality of life and the quality of health and care that they deserve, probably a lot less of us will have to go through dialysis, because the will is there, but they should be rewarded. They should not be penalized. Thank you for your attention and your consideration.
So we've got time for a couple of questions, if anyone has one, before we call up our next panel. And if there are no questions, we will thank very much Louise and Angela. Thank you so much. It was really great. Now you see how lucky you are to work at the American Kidney Fund. All of our patients, our advocates are just incredible. We're so lucky. I now want to call up our last panel, and this is our panel that's going to talk about the burden of caregiving, and as well as being a donor for family members. So our first panelist is Heather Winfrey. She helped care for her husband, Steve, who is also here today when he went on dialysis a few years ago after his kidneys failed. Last summer, she surprised him with a personalized baseball card. He's a very avid baseball card collector, to let him know that she was a match and that she could give him one of her kidneys. They also, Heather can tell you more about this, but that moment was recorded and it went viral. And 70 million views? A lot of views. That's a lot of views. So the kidney transplant was successfully completed this fall. So that's amazing news. And the Winfreys are also foster parents. And I also would like to call up Melissa Baker, who's from Philadelphia. By the way, Heather is from Knoxville, Tennessee. So Melissa has had ESRD for 6 years and has been on nocturnal dialysis for 5 years. She and her mother was going to join us today, but her mother is actually taking care of her son. So as I said, it's a multi-generational caregiving. She is in the process of adopting her son, Isaiah, whom she has been fostering. And we got to meet Isaiah yesterday, and I'm sad he couldn't be here today. Apparently, Melissa told me that he's considered the mayor of her mother's apartment. That gives you a sense of Isaiah. So her mother, Ann, picks up Melissa at the dialysis clinic every day at when she's on dialysis at 4:30 in the morning, and is actively engaged in caring for her grandson, Isaiah. So with that, I will turn it over. Heather, if you'd like to start.
Thank you all so much for being here and letting me share my story with you. 8 years ago, I was introduced to kidney disease. I was then dating my husband, Steve, and things were getting serious, and he said to me, you know, I haven't told you this, but I have kidney disease, and eventually I will need either to have a transplant or to go on dialysis. Basically, do you still want to be with me? And I did. I wanted to marry this man, and so we ended up getting married, and his disease progressed, and I tell people that kidney disease is a family disease, and I don't mean just hereditary, although it can be hereditary. Kidney disease affects the whole family, and as Steve's condition worsened, I was no longer just his wife. I became his caregiver. I was the primary breadwinner and the foster mom, and the stress was so much. But he was my hero. He is the strongest man that I know, and I love him with all my heart. And seeing what he went through dialysis, without a shadow of a doubt, I knew that I was going to donate to him. Back when we were dating, when he told me that, unbeknownst to him, I started doing research on living donation 8 years ago. And he ended up having to start dialysis a little bit early. And seeing him on dialysis was so incredibly hard. And so I started the process. I wanted to see if I could donate to him. All these years I had thought, when it gets to this point, I will donate my kidney to this man. And that week of not knowing if I was going to be a match was so stressful, because all this time I had known, like, I'm going to donate to this man, and then I was like, oh, there's these tests that I have to pass now. And so I just decided in my heart, I was like, I can't think of the possibility of not donating, because that was going to devastate me. The odds of me being a match were so small that I knew I had to. So I just started planning, how am I going to tell him? Because I have to focus on the hope still. And so I decided to use a baseball card, because that's something that we would do to keep his spirits up whenever he was in the hospital. We would do something from his childhood, collect baseball cards. And so I put a custom baseball card in a pack of cards, with his face on the front, on the back, telling him that I was a match to donate the kidney to him. And a few months later, after all of our testing was done, I donated my left kidney to him. And I remember in recovery, being in excruciating pain. I'd never had surgery before, and apparently I'm kind of a wimp when it comes to pain. And I remember the pain management doctor came to visit me to talk to me about pain medicine and see what they could do to make me more comfortable. And we talked about the pain, and as he was leaving, he turned back to me and he said, "Can I ask you one more question?" And I said, "Yeah, of course. What's your question?" And keep in mind, my backrest is all the way raised up. My feet are all the way raised up. I told him, I was like, I have to be in this position, because if I lay flat, I feel like I'm going to rip apart. That's how much pain I'm in. And with that in mind, he asks me, knowing what you know now, would you do it again? And I immediately just teared up and said, this is the best thing that I have ever done. And it truly is the best thing I've ever done, and I would do it again in a heartbeat for a complete stranger if I could just grow another kidney. But today I'm here to share my story, but to also let you know there are donors like myself that weren't as fortunate as me. Currently, the family medical leave doesn't cover living donors. My employer let me have that time off, but it doesn't cover all donors, and people are getting fired from their jobs while they're recovering from saving somebody's life. And that, I've talked to these people who've said, I won't change it, like, this is the best thing that I've done. But now, I mean, my family is in a position of financial ruin, and they have to pick up the pieces, and I want this legislation passed so much so that the donors after me and the donors after the ones that I know that have lost their jobs or have struggled with insurance issues or not qualified for disability because it's an elective surgery. We need to get this covered on disability insurance. This is a life-saving treatment. It's just not a life-saving treatment for me. It's a life-saving treatment for that man that I love. And I don't want there to be any roadblocks other than that decision. Do I want to save someone's life? I don't want there to be a roadblock. Can I financially possibly do this? I want those roadblocks removed so that people can make the decision to do the right thing and to save somebody's life.
Thank you, Heather.
Alicia? Good morning. Thank you all for being here for this important issue. My name is Melissa Baker. I'm from Philadelphia, PA. In 2005, I had my first transplant. I had a kidney and pancreas transplant, double organ transplant, and PIN. I had a deceased donor at the time from a family who was generous enough to donate their daughter's organs. My transplanted organs lasted 6.5 years, and that was a great time for me. During that time, I became a foster parent to a young lady who was a teen at the time. When she was 18 years old, she gave birth to my son, who I'm in the process of adopting, Isaiah. And in 2012, I went on dialysis because unfortunately my transplanted organs began to fail. My first experience with dialysis was as a peritoneal patient. I was doing that at home, but it didn't work out. I did that for about 7 months. It did not work out at home for a variety of reasons. I had some health-related issues, and I found it to be incredibly isolating for me as a single woman. I didn't have a lot of company when I was at home or anything like that, and I found that my home felt like more of a medical facility than anything else. So I spoke with my social worker at the dialysis center that I was affiliated with, and fortunately, the area that I live in had just started nocturnal dialysis. So she mentioned to me, the social worker mentioned to me that may be a better option for me. So that's what I began doing. I was the third patient at our dialysis center, at DaVita in Philadelphia. So I began that process. So I started nocturnal dialysis, which is overnight. I sleep at my dialysis center 3 nights a week for 8.5 hours for each treatment. So it ends up being about 24 hours worth of dialysis per week, which I know that for me and for most people that's a little unusual, because even when I speak with some of my doctors, they still haven't heard of nocturnal dialysis, so I'm always having to explain that I do hemodialysis, but it's also nocturnal hemodialysis. And while that's been the best thing for me in managing my end-stage renal disease, it does create an added burden on my caregiver, because not only am I the caregiver for my son, who is 5.5, my mother cares for him as well, while she essentially cares for me, because on those nights that I'm away from my son, which is 2 nights per week and 1 night on the weekend, she has to care for him. So she's, getting him dinner, and she drops me off at my center in the evenings. She picks me up at 4 o'clock in the morning and takes me home, and then I get a little bit of rest so that I can start my day. So she drops my son off at school twice a week, and she also picks him up on the days that I have dialysis, so that I can get dinner and everything ready for him when they get home, help him with his homework, and spend some quality time with him, because he misses his mom. I'm away from him 3 nights out of the week, and he misses that time with his mother. I'm his only constant source of support, other than my parents. But he lives with me. So he misses that interaction time that his classmates have with their parents. My schedule sometimes does not allow me to attend different activities and functions at his school, because it just does not work out with my dialysis schedule, because I'm just too tired in the morning to go to an 8 o'clock gingerbread breakfast at his school when I'm only getting home at 5 o'clock in the morning, and I still need to get some sleep and be able to function and deal with a rambunctious 5-year-old. So even though that has been my schedule, my dialysis schedule for 5.5 years, it's still a really difficult schedule. It's a predictable schedule, but it's really difficult, and I feel bad for my son, because he'll say, "Oh, okay, Mommy, is this the night that you go to the doctor?" And he knows what the schedule is at this point, because he's learning the days of the week and chronological time and all of that. So he knows what days are my dialysis days, but it's still difficult on him at times, which makes it even more stressful on myself, because he's like, "Oh, Mommy, I wish you could not go tonight. Can you not go tonight?" But I have to always explain to him that I need to go in order to stay as healthy as I can for you. And then I think about the added burden on my parents as well. And although my parents are incredible, my mother is incredible. She's with my son right now, because this would just have been too much for him to be in a room like this. So she's back at the hotel with him right now, keeping him contained and occupied. But I think about that added stress that it causes on her, because she's retired, and I didn't envision her spending her retirement as a primary caregiver to a 5-year-old. I wanted my parents to be able to enjoy that time and do the things that they wanted to do, because they worked so hard during their years in the workforce. Prior to me going on dialysis, I had a pretty successful career. I was in benefits administration, of all things, as well as human resources. So, I miss not being able to work anymore. It creates a financial burden on myself, because my income is severely limited. But I thank the American Kidney Fund for picking up the cost of my insurance, because without the American Kidney Fund, I would not be able to pay for my Medicare and supplemental insurance. It would be a real hardship on us. I'm a single mom, and I'm on a limited budget, and they pick up the cost of those medical insurance premiums that would create an added level of stress for myself, which creates a physical burden as well, because being on dialysis is not just about the physical aspect of trying to keep yourself healthy physically. It's about keeping yourself mentally strong as well. And I always tell people that when they come to our center, is that 50% of the challenge is being emotionally strong enough to deal with all of the other issues that come with being on dialysis and living with a chronic illness such as end-stage renal disease. I mean, you have fears about how long you're going to live, how long is your access going to work, whether or not you'll be able to provide for your family, how long are your employee benefits going to go if you're still of working age. Just a host of issues that come along with that. Will I receive an organ? How long will I wait? Is my new organ going to work? I mean, it's just a lot of other issues other than just the part about being hooked up to a dialysis machine from anywhere between 3 or 8.5 hours like I do, for myself, being on nocturnal. So I just want everyone to consider that when they're talking about the Access to Marketplace Insurance Act and the Living Donor Protection Act. I want all of our representatives here to just put a face. We are the face of kidney disease. We have families. We have hopes and dreams. I want to see my son graduate from high school and go on to college and become a successful person. But I do worry about that. Those are some of the fears that I have. But I know that I have a voice in this, and I know that I can speak for those individuals who maybe feel like they don't have a voice, and I think that this is my responsibility to be able to do that for them, because this is something that has touched not only my life, but the lives of my family as well. And I just thank you for your time. Thank you.
Thank you so much, Melissa and Heather. That was great. Thank you so much. Are there any questions or any comments from anyone?
I just wanted to make 2 quick comments. Heather, you had mentioned that as you saw your husband going through all of what he went through, that he was your hero.
And may I interrupt? I'm sorry, and say that he is the husband.
Oh,
She ruined it. I ruined your punchline. Sorry.
You ruined it. Yeah. You made a comment that as you were going through everything, that he was your hero. I'm willing to bet the fact that you never left his side in the hospital, the night that they said that I wasn't going to live through the night, and you laid in bed with me and sang, and then you saved his life, that you're his hero. The second is, thank you for saving my life. I love you.
Well, with that, I think we will close out our briefing. Thank you again to everyone on Facebook and everyone who's in the room. We really, really appreciate it. But of course, most of all, I want to thank our advocates and our speakers. And like I said, we're so proud to work with you. So thank you again.